breathe into a paper bag. That's not a thing. The problem with breathing into a paper bag is you'll cause them to pass out. What we want to do is put them on a non-rebreather at a low level. So you put them on like 10 via non-rebreather, and it causes them to rebreathe their own CO2. And it'll quickly slow down their respiratory rate. The problem is the body is in acidosis. So what you want to do is, and they're blowing off CO2 because of the fact that they're in acidosis. Okay, so what you want to do is get them to rebreathe the CO2 to slow it down and try to get them to the hospital to fix the underlying acidosis. What's going to happen is, if this stays this way, they're going to result in alkalosis. Now, alkalosis means that it's a buildup of a base inside of the bloodstream. So that's why we want to get them to rebreathe that CO2. Okay. What the symptoms that you're going to see with this are anxiety, and the longer that they're hypoxic, they're going to become agitated, then they're going to become altered, then they're going to become unresponsive. They'll be dizzy. They'll have what's referred to as carpal pedal spasms, where they breathe so fast that their fingers knot up.
Right.
Okay. And they'll have that numbness and tingling. It's referred to as carpal pedal spasms. Okay. You'll see that again. All right. Okay. Then we have environmental exposure. Like I said, the thing with environmental exposure is one of them that we see very, very, very often. Matter of fact, I just saw it last shift, was carbon monoxide. It's odorless. You can't smell anything or see anything. It's very poisonous, and even low levels at 35 parts per million is enough to cause lifelong debility, okay, if not death. Okay, a lot of times it's fuel burning appliances that don't completely burn the fuel. You'll see this in homes, especially older homes, that'll happen. We had a carbon monoxide leak just last shift. Lady was in the house cooking, the alarm's been going off all day. She thought it was just because of her cooking. She didn't think nothing of it. Sure enough, the kids, were in the living room playing this, that, and the other, and they got quiet, and they were fine. But it was just the fact that that alarm kept going off. So finally, one of the neighbors called. We get there, at the carbon monoxide alarm, it's 30 plus parts per million, and we're like, okay, everybody evacuate, mask up, and this, that, and the other. So always be careful with that.
We see it a good bit in Jasper County because, it's the poverty there is pretty high, and
yeah.
But we see it a lot in the winter time.
Really?
Trying to keep their houses warm.
Yes.
Like I've seen people with charcoal grill right in their doorway, and luckily we was able to get her out. But
yeah.
It's stuff like that. It happens a good bit over that way.
All right. We're going to talk about. Let's see. Let's skip forward just a little bit. Okay, so we're going to talk about treatment of specific conditions, okay? For your lower and upper airway obstructions, like I said, what we're going to do, and this is your croup, your epiglottitis, right? We're going to treat this with humidified oxygen. And like I said, if you have kids, flavored oxygen. Keep a little thing of chapstick. I'm actually going to do that now. Keep a little thing of flavored chapstick on the truck, which is pretty cool, okay?
You put it right in the non-rebreather, you said?
Put it right, just rub it onto the inside of the non-rebreather.
Right.
Yep. Don't suction the airway or place an OPA in this patient, simply because, like I said, you irritate that airway, it's going to shut down on you. Okay? So give them humidified oxygen and drive really, really fast. Okay? Position them comfortably. If you think it's epiglottitis, the way you'll know that is the severe drooling. Let them sit in mom's lap and drive really, really fast. Okay? That's my suggestion. Okay? I can't tell you to do that because it's against the law, but that's my suggestion. Let them do whatever they want to do. Pulmonary edema, specifically congestive heart failure. Suction is necessary if you see pink frothy sputum. Position them comfortably upright, or at least in semi-Fowler's, if not Fowler's position. CPAP. CPAP. Again, I have to look up, and I'll get it for you, what DHEC's protocols are for EMT, but I know CPAP is indicated in DHEC protocol. Transport them immediately. We do not play around with this. Okay? And if they are on nitro, give them nitro if they're having any sort of chest pain. Okay. COPD, assist them with their inhaler or albuterol if they have it. Watch for the side effects from overuse. One of the things you'll see is a rapid pulse with that if they're using too much of the albuterol. Okay. Sit them upright because that's going to be their position of comfort typically, or in a tripod position in transport. Okay. Asthma, again, do not waste any time with asthma treatment. If they have an inhaler, help them with their inhaler. If they have albuterol, help them with their albuterol. That's within your scope as an EMT. Okay. Aggressive airway management. Have suction ready, have oxygen ready, get ALS en route. You do not want to play with that because they will go from that to unresponsive very quickly. Okay. Hay fever, they just have a summer cold. That's all it is. Right. A spontaneous pneumo, you're probably going to have to bag this patient. Okay. You're probably going to have to bag this patient. So get supplemental oxygen ready. And remember, anytime we're dealing with anything airway, always have suction ready because you never know when that airway is going to go to crap on you. Okay. If it's a pleural effusion, fluid removal must be done in the hospital, so they actually have to go in and do a chest tube and drain the fluid out. You're going to have to bag this patient because, like I said, this and this are very similar. Okay. These two are very similar in that they're compressing that lung, gas exchanges are taking place. Okay.
Now, mostly when those two are going on, and are they going to be? I'm sure they'll be conscious.
Oh, they'll be conscious and alert. Oh yeah, oh yeah. Conscious, alert, and talking to you, and severely hypoxic.
Right.
Okay. Agitated or anxious. Okay. Obstruction of the airway. Of course, you have partial obstruction. That just means that they need oxygen. But if they have a complete obstruction, you're going to clear the obstruction using either the Heimlich or using chest compressions if they go unresponsive, and put them on oxygen as necessary. Okay. Okay. And then once you get the airway clear, you're going to want to put them on probably CPAP to keep those airways open. Okay. The last one that I had to put him on CPAP because he had an airway obstruction that caused him to nearly go into, he went into respiratory arrest. And I got him back, and we got him back, and I actually had to intubate him, and he coughed because I irritated the epiglottis. He coughed, and the obstruction came out, which was an entire slice of pizza.
Wow.
Yeah, and all the beer that was in his belly all at one time. And so because he had aspirated, I put him on CPAP. Because usually when this happens, an aspiration is going to take place. Okay? So CPAP won't hurt him.
And you said that helps, like, especially whenever you aspirate or you got something else going on. That helps. Of course, you're forcing air in, it's positive pressure, but it helps push all that stuff out.
Push the fluid out and whatnot, and push the mucus out the way so the oxygen can get to the alveoli.
Right.
Yes. They'll still need antibiotic treatment for the aspirate and all that stuff,
right.
And probably deep suctioning. But at the very least, we're using a mechanical stent to open that airway in CPAP. Okay. If it's a PE, supplemental oxygen is mandatory. You want to place them on their left side, and you want to bag this patient. Okay. If they have hemoptysis or they're coughing up bloody sputum, clear that airway, suction, 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 drive super fast because this patient will code on you very, very quickly. Okay. It doesn't take much, but we want positive pressure ventilation for that patient. Okay. Hyperventilation, do not ever give a patient a paper bag. You want to reassure them. You want to put them on supplemental oxygen, low dose oxygen, low dose, high flow oxygen. So you want around 10 liters per minute of oxygen, just so they have some oxygen coming and they can rebreathe their own CO2. Okay. Environmental, again, treat them like they're contaminated. Ensure that they're deconned depending on what they were exposed to. I mean, you don't really need to decon sawdust, but treat with adjuncts. Suction is necessary. Okay, for on-body airway obstruction. Excuse me. Clear the airway as much as possible. Suction, 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 and oxygen. Okay. Tracheostomy dysfunction. Yay! Who doesn't love a trach? Suction. Now, trach suctioning is a little different. Because trach suctioning is usually deep suctioning. What you're going to do is you're going to measure from the xiphoid process, okay, because that's where the carina is. You're going to measure from the xiphoid process to here. okay? And so you're gonna go in a straight line from here to here, you're gonna measure, and then that's only as deep as you're going to suction, okay? You're not gonna go any deeper than that, because you're gonna pull mucus plugs up and you're gonna cause them to cough up whatever's in there, which is a good thing, okay? You're gonna cause them to cough up whatever's in there, okay? Asthma, you're gonna give them blow-by, probably CPAP, depending on the severity of it, and you're gonna use meter dose inhalers, okay? And if they have albuterol, you're going to treat them with their albuterol. Okay, that is in your scope as an EMT. Cystic fibrosis. Okay, this is a genetic disorder that affects the lungs and the digestive system. If a child has a repeat lung infection, these are the kids that are going to have that. The symptoms you're going to see are everything from wheezing to asthma-like complaints. You're going to see significant wheezing. And the way to treat this is just suction. Okay, you want to suction them and you want to keep them in a semi-upright position, like semi-Fowler's to Fowler's position, to keep that down. And also after feedings, you want to make sure that they stay, because of the fact that they have that tightening of the lungs, you want to keep them in a semi-upright position because they aspirate frequently. So you want to always have suction at the ready. Okay. Yeah. Any questions about any of that? All right. So what we're going to do, we're going to take a quick break, and then we will go over GIGU. Okay?